Mr. Chairman, ladies and gentlemen, thank you for the opportunity to talk today on the history of laser in medicine and surgery in New Zealand. I'm from the University of Otago, which is one of the centres that's been involved in laser in medicine and surgery. Talking a range of applications, but I have to say that in New Zealand there has been limited use of laser technology in medicine and surgery to date, and hopefully you'll get a sense as I continue where this work has been done. New Zealand, Haere Mai, these are Maori singers, and to give you a flavour of the local culture in New Zealand for those of you who haven't visited. New Zealand, just as a snapshot, is a population of about 4 million. It is a westernised democracy established by a treaty between the British Crown and the Maori people in the late 1800s. The head of state is actually Queen Elizabeth II. It's a socialised medicine system with universal coverage, and particularly there is the Accident Compensation Corporation, which is a no-fault insurance for health insurance. The health indices are good. New Zealand at one stage in the early 1900s had the greatest life expectancy in the world. That has been overtaken by Japan, of course. But otherwise, figures for infant mortality, longevity compare well with OECD countries. There are, however, major differences between the Pakeha, former Europeans, and the Maori indigenous population. There is limited use of laser, and it tends to be in these three areas for the most part. And I'd note something in passing, and it's relevant to the conversations we were having earlier. In physiotherapy and in rehabilitation, at undergraduate level, physiotherapists are trained in the use of low-level laser therapy, whereas in medicine and in dentistry, this does not happen. And I think that is quite a disappointing situation and something that needs to be addressed. Just to orientate you, there are 4 centres that I'll be talking about. Tauranga, University of Canterbury, where we had our NZ laser meeting last year, and of course the University of Otago. First of all, Tauranga, which is in the North Island, the University of Canterbury, which is in Christchurch, NZ Laser was in Queenstown for those of you who were able to attend, and the University of Otago is based in Dunedin, but also its medical school is split between Dunedin, Christchurch and Wellington. So these are the important centres, and they are spread across the country, as you can see. The majority of the population live in this area here and in the North Island, about 3 million, and less than 1 million live in the whole of the South Island. What sort of applications are there in New Zealand? Physiotherapy and rehabilitation, although that's limited. Acupuncturists use lasers as an alternative to needles, although that's not well studied. There are applications in dentistry for surgery, in dermatology for treatment of port wine stains, urology particularly for treatment of benign prostate, and of course standard LASIK and aesthetic medicine treatments, which are becoming more popular and of course in some instances unregulated. For timelines, first of all, to note that there was previous use of phototherapy in New Zealand, which would mirror applications elsewhere, for instance in the UK, so the use of ultraviolet, for instance, in treatments of dermal tuberculosis. But it wasn't really until the late 1980s that applications started to take off. In physiotherapy, you had the widespread promotion of laser devices as another alternative electrotherapeutic agent. But within the case of dentistry, Tom Cardas and colleagues started using the CO2 laser, which no doubt Isaac would be really pleased to hear. Walker et al. Were using them in dermatology for treatment of port wine stains using copper vapor lasers. By the early 1990s, Campbell was using an argon laser for treatment of problems with the eye, particularly around the lashes. And Gilling's group, which is one of the most prolific, started use in urology using the NDEI and subsequently the holmium laser. Kenton Smith et al., based in Wellington, started using pulse dye lasers in surgery, particularly for treatment of viral warts. Since 2000, these groups that I've mentioned, particularly Gilling's group, have continued their work. But we have started looking at, first of all, applications in physiotherapy, and Steve Tumilty, who's here, been looking at treatment of tendinopathies. Phil Peplow and colleagues have been looking at basic studies on diabetic compromised healing, and I've been looking at evidence base for some laser applications. And of course, we were very fortunate last year to host a meeting in Queenstown, which was well received. For the future, the physiotherapy research is going to continue. Basic mechanisms around compromised wound healing, particularly with Phil Peplow, looking at a new model of diabetic compromised healing and a model of diabetes in animals. And Steve has been liaising with Professor Longo about potentially looking for the future at treatment of diabetes. That, in summary, is where we are in New Zealand. And just to give you a sense of the country we enjoy, this is photographs just sent to me yesterday over the Milford Track in the South Island, and thanks to my colleague Lexi Wright, who walked up the mountain to take the photograph. Thanks for your attention.